Welcome to Bite Size Dental Marketing. Today I have Ian, who's back from a wonderful European vacation, and Saria, who never leaves.
We actually have a hard time. We have to force her to take holiday.
It's
I've
true.
left more this year than I have in the last few years, so I need some
Mm,
credit for that.
mm. And today we're going to talk about what makes a perfect client for a marketing team and
Mm.
some of the attributes involved. And
The
Ian, what do you
important
got?
thing here too, especially for our dentists listening, is take notes from this. If you're not doing these things, you might be hindering the ability for your marketing team to either do their job, which directly relates back to the potential performance of your practice. So if you're not bringing your part, you can't expect your dental marketing team to just do wave a magic wand and make things happen, because it's a two-way street.
Hmm.
So
Absolutely.
I think for me, if I can kick it off on more of the action item side, as I was mentioning now, one thing that we really love about our clients and the ones that stick out to us is those who are willing to put in the work with us. If we need material, if we say, okay, you're going on a trip to go help kids in Africa with their dental health, or you're going to go help the old age homes in your town to do this and this, please take pictures. Please speak to someone. Please get a testimonial or
Hmm.
something. The doctors that are pulling through and sending that through to us, it makes our lives so much easier, because on the ad side, we can run ads, we can do Facebook posts, we can post it to the Google My Business, and it just makes our job easier when you help us to put the best foot forward of the practice by sending us those type of things.
Yeah, absolutely. And Ian, as you're talking, one thing that I thought about is I feel like like in any relationship, as long as the client values and kind of the marketing values or your other team's values align, it just is a beautiful combination. And a
Mm.
lot of that comes from the values being aligned, because if you are committed to your practice, you're trying to make it grow, but you're looking at the bigger picture of how to grow and what is important to you, then it ultimately ties down to the client having more dedication and just more heart into doing the things that needs to be done, and not just saying,
Hmm.
I've hired a marketing company. It's like a switch being turned on, and
Make it
where are the new
happen.
patients?
Yeah.
Right.
Yeah.
Yeah.
Yeah. I think I went somewhere. I have my notes here. I think I went somewhere similar, Saria, as you did. I looked down the list of clients, and I tried to put a little work in it, since you chastised me for not being prepared for the weekly content session. And I looked at the people who I perceive to have good results, and then I looked at some accounts that might be struggling. The people who marketing tends to work better for, you're right, they want to grow, they're
Yeah.
but I think the other part of that is they're willing to change some things operationally, and they're willing to try new things. That and the other one was they have a stable staff.
And for the doctor to work with us, and any marketing agency that they're working with, to get their staff on board, to get
Hmm.
the OM on board, to get the hygienist on board, because I've seen when I have a good relationship with the front desk and with the rest of the team, it goes better. Things go better because I have a whole team supporting me in the marketing efforts that I'm trying to put in place, and they are in sync with what we're trying to do, and then things just run a lot more smoothly.
I have a question for you though.
Mm-hmm.
What does a dentist say when they're not seeing results? So I mean, we're let's assume I believe in you. Let's assume I'm I'm trying to do the right things and I'm not seeing results. How then what how do I measure results? How do I talk to you about it?
I mean, that's the age old question in marketing of what is the true value of marketing. And for me, there's two sides of it, and this is how I would explain it to a dentist. Is, of course, we have the number side, and this is when you come to me and say, I'm having a slow month, what's going on? There's things that we can do. There's things that we can try and do. Like, I mean, from suggesting that you go to a wedding expo, which one of the clients I'm working with right now out in California, to something like reactivation existing patients. There are things that we can look at to try and boost that and get it back on track. And if it just doesn't recover at all, okay, then we can have a real conversation. If this is not really working for you in any way and nothing we're doing is working, let's have a conversation. But that is just one part of this equation, and that is what the ideal client to me needs to understand. The other side of this is without this marketing presence, your website is at risk when something goes
Mhm.
wrong. You have no one to fix it. Your online presence is not constantly being worked on. When things do turn around, we know America is in a tough place economically right now with inflation and interest rates. When things do swing around and the growth starts happening again and people are more comfortable to spend money, are you the first thing that people are seeing? No, because you fired your marketing agency 3 months ago and now you're on the sixth page of Google
Mhm.
and you want to understand, well, this is terrible. Why is this happening? And that's where, for me, it's a double-edged sword in the sense of, yes, there's a marketing side, and I'll answer that way, but the number side. But on the other side, it's having this team behind you that supports you in all things marketing and that helps you keep that presence online, which is so important these days, is the other side of that equation that is just as important as your new patient numbers.
Yeah, and to answer your question, Eric, I feel like if I'm a dentist and I do trust my team, ideally, hopefully, I don't have to tell them that things are going slow because we're already in clear
Mhm.
communication and we
Mm,
already know this is what we anticipated, and we've talked about the seasonality and how things are going in the industry at the time. But I feel like what makes a difference is the frame that you view the problem through. Are you saying you don't see the results equals marketing isn't working? Or are you saying I'm not seeing results, let's problem solve this? And I feel
mm.
like that is what we see in our ideal clients, the ones that we've been able to drive results, is they're willing to problem solve and figure out what piece of the patient journey or what piece of everything
The
is the
calls coming
problem.
into the office, how are we fielding the calls? How's the
Right.
Mhm.
patient journey? Can people find the practice, or is it difficult to find it to begin with? All of those things. I completely
Exactly.
agree.
Yeah, one of the misconceptions I feel that some dentists have, and I think even good clients have this, is when I hire a marketing team, my chances of having a bad month go down. I, I still think you're going to have a bad month. There's a finite number of people who are looking for a dentist in a specific geographic region at any given time, and that does ebb and flow with some seasonality. And it's interesting as we come up on October of 23, we're 6 days in. I think that this year has been the first year in a number of years that we've gotten back to a real seasonality where we started the year strong. We saw sort of a little bit of a fall off through March and April, and we saw June, July, and August pick back up, and we've seen September sort of fall. And we've seen a more normal year. And if you look at September versus August, it's down, but that doesn't mean the marketing didn't work. That there's
Mm.
some element of seasonality that is in dentistry that is there. And I think you said something earlier that resonated with me. It is hard to gain market share in a down or declining demand time. So if fewer patients are searching, it is harder to gain, a bigger majority of those patients. But when it's climbing, if you've invested in your SEO, if you invested in your content, if you invested in, the video production and things like that, it is more easy to gain market share in a rising demand time.
Mm.
And I think that, there's been all sorts of memes and sayings about marketing, but you know, you should you should market in the hard times for when the good times come, they're going to be better. And I think that's true in dentistry.
That captures it perfectly.
Yeah,
Perfect.
beautifully said.
Beautifully
And
said.
you know, to that point, I also think that whenever the business owner themselves have a kind of a clear vision of who they are and what they really want, it just makes the marketing piece so much easier because we're able
Mm.
to, in the position mapping, we're able to map exactly where you are compared to your competitors and what are your strengths and what we can highlight and what we need to push forward to get you to where you want to go. If you know your destination, it's a lot easier for us to navigate you there.
Sorry, um, did you just casually throw out position mapping?
I've been learning about position mapping, and I
Mm,
think that that is very, very much
mm.
something that we should do. But um, obviously,
Just
that
gonna
requires
casually
some
roll it off out
education.
there and see if it sticks. Okay.
I guess it's stuck.
Yeah.
Uh,
And everybody go Google marketing position mapping. It is easier to magnify a story, like you said, than invent one.
hmm.
And the problem with inventing one is I'm inventing it for you and you're not, it's not your story. And
And it
yeah,
creates
that's a,
unhappiness down the line sometimes.
mhm.
We've seen that more than once,
Yeah.
where we say, okay, we'll help you, and we build the brand, and we help the slogans, slogan. I said the same words at the same time.
Slogans.
Sorry, slogans,
Slogos.
uh, slogos. And we help with all of that. And then 6, 7 months into it, you hear the client going, well, this isn't me. And that's a tough one, because
You know,
now you have to rebrand completely again, and that's not something you want to do because it costs a lot of money.
do you know what I think more impactful than that for me, Ian, is when they say, I want more cosmetic patients, and we say, okay, we're going to stop marketing for general patients, and then 2 months later they come back and say, I haven't seen any patients. I want more general patients,
Hmm.
and we're like, okay, we're going to move the money back over here, and they say, wait, but I still want my cosmetic, and you know, I I think that's my version of what you're saying. I think that's my version of knowing who they are is I can market high tech and market down to earth and market I'm expensive and I'm worth it. When those bounce around from I want to do implants and then I want to do cosmetics and then I want to do sleep and I want to see journalists, that is underestimated in how difficult that is to shift strategies
Hmm.
and how I don't want to say harmful, but how much setting back happens
Hmm. I
in
agree.
there and knowing who you are and being able to say this is the type of patient I want is important. And
Is
I don't think you
important.
have to choose between this and that, but I think with limited resources, you do need to have a focus.
Hmm.
Our dream marketing client, based on all of the things that we talked about, is likely somebody who understands that marketing is only a piece of everything that you need to be successful. They're dedicated to the growth of their practice in every which way possible, and they see us as a team. You see your extended team as part of somebody and some resources that are helping you grow. You have a clear vision of where you want to be and what you want and what kind of patients you want. And yeah, there's just a wholesome coming together of all of these attributes and the values aligning.
Hmm.
Well
Be
said.
it be a team.